The ordeal has been punctuated by moments of exquisite compassion. I have been the recipient of an extraordinary array of human and humane responses to my plight.
Ken wrote an article that was published in the Boston Globe. He was figuring out, trying to process this whole experience of his illness and what it meant to him personally, as well as what it meant to him in regards to healthcare delivery.
I will never forget the Sunday morning when I opened the Boston Globe magazine and read his article. I thought it captured better than anything I had read how meaningful it is to patients to have people looking after them who really care about them. That article just had a profound impact on my thoughts of my career and being a physician.
Ken obviously was a powerful force in those moments leading up to his death. His mind and spirit were so active at that difficult time, thinking about how his experience could teach others.
But when people are harried, I don't care how strong their healing gifts are, they're going to have trouble practicing them. And I think we're getting to a point where employees of HMOs are told they can only spend a certain amount of time with each patient, no matter how complicated the case. That is a rationing of time, and it's a rationing of empathy. It's not going to leave doctors the time or nurses the time to really care about, get to know, and empathize with their patients.
He wanted to have some kind of a center that would really look at or study the relationship between patients and their caregivers.
Family, friends, and caregivers came together, and they were trying to figure out how to actualize Ken's vision. They went to the clinicians at Mass General and they said, what can we do to make your very difficult lives easier? What can we do to help you care for patients and families? And they said that we really need a safe space to be able to talk about the tough psychosocial issues that we face every day in caring for patients. And that was the birth of the Schwartz Center rounds.
When I remember how nervous people were, could this work? And how important it was for nurses and physical therapists and social workers to see how doctors dealt with these issues, and for doctors to see how other healthcare professionals dealt with the issues.
In the day-to-day hustle and bustle of everyday work, it's hard to find times to talk with your colleagues about how meaningful a particular patient was to you, how difficult a particular patient was, and having these rounds where those sorts of topics are the central agenda item, I think is very meaningful to our staff.
Margie and I went to St. Vincent's Hospital in Worcester, and we went to see how Schwartz Center rounds would work in a hospital that was a little bit different from the MGH. That day, Marjorie and I turned to each other, and we knew that there was something special about the Schwartz Center rounds, and we knew that the Schwartz Center rounds would translate to hospitals throughout the United States, and now we're finding out throughout the world.
Being recognized for something that I was doing every day made me understand compassionate care was equally as important as the science of healthcare. To have an organization at a national level promote this is very, very encouraging.
Recognizing compassionate healthcare when it occurs has a very big impact to role model that for younger physicians, and not only for younger physicians, for established doctors, nurses, social workers, to be able to see the importance of compassion and to show that it's valued at the very highest level, that you care about what you're doing for your patients.
What the Schwartz Center has allowed us to do here at Montefiore is bring the healthcare team together, allow them to be introspective, allow them to explore their emotions, make safe that exploration, and improve how they provide care in the most compassionate way on a daily basis.
Having Schwartz Center rounds at UAB Hospital has allowed our staff, our leadership, our faculty at all levels to see the value of relating to our patients and our families in a different way.
To be able to talk about certain aspects of caring for somebody in an open forum like that, where somebody else is willing to listen and then give you feedback about what you said, that I remember distinctly as being very, very special.
administrators who make this a priority and who say clinical care doesn't mean just taking care of an illness or a body, it means taking care of a soul and a spirit. And I think that signal has to come from the top.
We at the Schwartz Center have to elevate compassionate healthcare to a national priority, to make it a fundamental element in the design of systems of care, the provision of healthcare, the measurement of healthcare quality, patient outcomes, and the education of all healthcare professionals.
The American Hospital Association presented the Schwartz Center for Compassionate Healthcare with our Award of Honor to recognize their exceptional contributions to the public's health and well-being. We were particularly impressed with the Schwartz Center Rounds. This innovative program recognizes the needs of caregivers on the front lines.
So over the next 20 years, we want to make sure that clinicians, patients, leaders, and others understand and value compassionate healthcare. We want to be the go-to organization that supports, educates, and trains clinicians to provide compassionate care.
The thing about that article that's so remarkable is the impact it's having today. How people can read an article from 20 years ago and still have it resonate with the kind of issues that we're dealing with today.
These acts of kindness, the simple human touch from my caregivers have made the unbearable bearable.
In such a cost-conscious world,
with its inevitable reductions in staff and morale, can any hospital continue to nurture those
precious moments of engagement between patient and caregiver that provides hope to the patient and vital support to the healing process.
Each of us wants not simply the best possible care for our body, but for our whole being. The deep caring and engagement of my
caregivers have been a tonic for my soul.
Again and again, I have been touched by the smallest kind gestures. A squeeze of my hand,
a gentle touch, a reassuring word.
In some ways, these quiet acts
of humanity have felt more healing than the highest dose of radiation and chemotherapy that hold the hope of a cure.